Hello everyone, my name is Hannah Boysel and this is my Health Leader Evaluation video presentation. So the two health models that I am going to talk about today are the GE Institute for Transformational Leadership Development Variable and Process Model and the National Public Health Leadership Institute Model of Leadership Evaluation. As well as comparing and contrasting the two of these models, and lastly, analyzing the process of capturing metrics for each within a health organization and choosing which model seems most appropriate, as well as explaining why. So model and introductions. So what is the GE Institute for Transformational Leadership Development Variable and Process Model? Well, this model assesses the leader on their ability to define and activate strategy, engage the organization, and drive results. As for the National Public Health Leadership Institute model of leadership evaluation, this model focuses on the individual leader development actions, network development, and network actions. In the GE Institute for Transformational Leadership Development Variable and Process Model, the healthcare leader is evaluated based on several factors and assesses leaders' ability to focus and engage their staff to exceed in their work. The measure of GE Institute can be stated in the form of a ratio being efficiency equals outputs over inputs. As for the National Public Health Leadership Institute model of leader evaluation, this focuses most on the individual leader development because this specific leader is in charge of a group of people and must maintain leadership within the group as well as establishing a goal to reach within. This model is also action-driven, so the leader within expects a high level of performance from their employees that they are in charge of. On to comparing the two models. Both models measure the strategic abilities of leaders as well as being goal-oriented. Along the same lines here, both models focus on a specific goal for that organization as well as reaching that goal. The GE Institute for Transformational Leadership Development Variable and Process Model and National Public Health Leadership Institute model of leadership evaluation both utilize quantitative and qualitative data. Both models express a certain quantity of things associated with the data that they have or are given, as well as the qualitative side of things. They both share many qualitative aspects. Contrasts or differences between the two models. Both models have different domains and constructs, as you will see in the next few slides. In the National Public Health Leadership Institute model of leadership evaluation, it is more detail-oriented as well as more things to look at than in the GE Institute for Transformational Leadership Development Variable and Process model. As the GE Institute model and is more straightforward within this model. The GE Institute for Transformational Leadership Development Variable and Process model has a clearer strategic approach than the National Public Health Leadership, and this means that they have a clearer approach to evaluating their leaders on their ability to lead and reach a specific goal within the organization. As stated previously in the slides before, GE Institute model creates focus, define and activates strategies, engages the organization, and drives results. But as for the National Public Health Leadership Institute model of leadership evaluation, this focuses on individual leader development, leader actions, public health systems and infrastructure development, network development, and network actions. Clearly, what each of these models focus on are completely different from each other, and they have different points of views on certain things done within an organization. In this next slide is the diagram of the GE Institute for Transformational Leadership Development Variable and Process Model. So as you can see here, like I stated previously, they create focus and develop rigor. So for the operating calendar, you can also see the points of view that they focus on and the strategic initiatives that they focus on. And then next is the define and activate strategy. So you can see the strategic plan, the operating plan, and goals and objectives, as well as all the bullet points for under those. And then engage the organization. So you see the values, the competencies, and behaviors, the performance management, the talents review, and of course, all of the bullet points that are associated with each of these. And then lastly is drive results. So you can see the operating reviews and the skill development, as well as those bullet points that associate each of those. Here is the diagram for the National Public Health Leadership Institute model of leadership evaluation. So clearly you can see that this is more detail oriented. There's more things that go along with each of these aspects, which is, as you can see, it focuses on the individual leader development, which you can see the greater understanding, skills, and valuing of certain approaches in the public health and leadership, as well as multiple other bullet points that go with that. Then you can see the leader actions, which then obviously you can see the bullet points it goes under, which is like career patterns, staying put, addressing issues, taking new jobs, taking on voluntary leadership roles, etc. for that one. And then you can see the public health systems and infrastructure development, which is the program change and development, the organizational change and development, different things with policy, system changes, and different things like that, as you can see. And then you follow with network development, which is showing just like the national, and then the organizational, local, and state developments, as well as the actions, the network actions, which also is the national, the organizational, the local, and the state. So capturing metrics. So for the National Public Health Leadership Model, this is more focused on the public thoughts and opinions, the political views and influences. So when we think about public thoughts and opinions, this leadership model focuses more on what others think, what others feel for improving an organization or improving the things within an organization. As for the GE Institute for Transformational Leadership Development Variable and Process Model, is more focused on the surveys of their patients and employees, as well as patient-employee satisfaction rates. So they focus more on the patient outcomes, the employee outcomes, what works best within the organization, as well as getting those surveys back and improving on things that they need to improve within that organization. So which model seems most appropriate to me and why? So I believe that the GE Institute for Transformational Leadership Development Variable and Process Model is best appropriate for this type of scenario because there are several points of view when it comes to their employees and the patients within the organization. There are many tools for the leader to understand both the organization's mission and vision statement, as well as their mission and vision. So they focus more on what kind of goal they have as to how they need to reach that goal. So I believe that the GE Institute for Transformational Leadership Development Variable and Process Model is going to be the most appropriate. And this is the end. So thank you so much for listening.